Okay, let's dive into a medical situation that is, thankfully, very rare, but also one of the most critical emergencies imaginable. We're going to explore what happens during a maternal collapse and break down the incredible coordinated response that's designed to save two lives at once.
All right, so first things first, what exactly are we talking about when we say maternal collapse? Let's get a really clear definition on the table.
So, in simple terms, it's a sudden life-threatening event where a mother's core systems, her heart, her lungs, or her brain, start to fail. We're not just talking about feeling a bit faint. This is a profound medical crisis that leads to a loss of consciousness. And, the timing is really key here. This can happen anytime during pregnancy, during the birth itself, or even up to 6 weeks afterward. Now, that number, 1 in 36,000, that's how rare the absolute most severe form of this, a full-blown cardiac arrest, actually is. So you might be thinking, if it's that rare, what makes it so incredibly challenging to deal with?
Well, the answer is pretty fascinating, and it all comes down to the amazing physiological changes that happen in a woman's body during pregnancy. The very things that help create and support a new life, they can actually become huge obstacles when you're trying to save one.
Okay, this right here is the single biggest problem. After about 20 weeks of pregnancy, if a woman lies flat on her back, the weight of the uterus can press down on two of the body's largest blood vessels. You can think of it like someone stepping on a garden hose. The flow just gets squeezed off. This one issue can cut the amount of blood returning to the heart by up to 40%. That's a massive drop, and it makes standard chest compressions way, way less effective. And that brings us to the million-dollar question, right? If your main tool, CPR, is suddenly working at a fraction of its power, what on earth do you do? How can you possibly save the mother? Well, the solution is both incredibly simple and totally brilliant. It's all about just getting that weight off the hose. And they do it in two ways. First, someone can literally use their hands to physically push the uterus up and to the left. At the same time, the whole team works to tilt the mother onto her left side. It's a perfect example of how a standard procedure like CPR has to be immediately adapted for the unique situation of pregnancy. All right, so we've got our life-saving maneuver. Now let's look at the bigger picture, the actual response. This is a high-stakes, coordinated effort that follows a very clear, very rehearsed plan. Every emergency response team has a playbook, and this is theirs. It's the ABCD approach. But, and this is the key part, it's not just the standard playbook. It's got crucial modifications just for pregnancy. For example, because pregnant women burn through oxygen so much faster, they get high-flow oxygen right away. Securing the airway is also a massive priority, since there's a higher risk of choking. Okay, this number 4, this is where things get incredibly intense. We're talking about a 4-minute window. If CPR, even with all those special maneuvers we just talked about, hasn't brought the mother back within 4 minutes, the team has to make one of the toughest calls in all of medicine. And that call leads to a procedure called a resuscitative hysterotomy. Now, you hear cesarean section and your first thought is probably save the baby, but here's the crucial twist. The number one reason to do this is actually to save the mother. By delivering the baby, you completely remove that heavy uterus, which is the ultimate way to get the weight off that garden hose. It can instantly restore blood flow and make CPR dramatically more effective, giving the mother a much better shot at survival. This quote really drives home the absolute heart-pounding urgency of it all. Should not be delayed by moving the woman. What that means is you do it right there. It doesn't matter where there is a delivery room, an ER, even a corridor. Time is so critical that the only thing you absolutely need to get started is a scalpel. It's that urgent. Okay, so the immediate life-saving interventions are happening, but the work is far from over. Now the team has to put on their detective hats and figure out why this happened in the first place. And they're not just guessing or throwing things at the wall to see what sticks. No. This is a systematic investigation. They have a checklist of the usual suspects, the most common, and most importantly, the reversible causes that they can treat right then and there. And that list of suspects is pretty wide-ranging. We're talking about everything from massive bleeding, what they call a hemorrhage, to a dangerous blood clot, maybe a severe infection like sepsis, or even an underlying heart problem that nobody knew about. It could even be a rare reaction or complication from high blood pressure. Each one of these culprits requires a totally different plan of attack. So that begs the question, right? For something this rare, this complex, and this incredibly high stakes, how on earth do hospitals prepare? Well, it really comes down to two things: people and practice. First, the people. This is not a job for one hero.
Think of it like a special forces team. When that emergency call goes out, a whole crew of specialists descends. You've got your senior midwife, the obstetrician, the anesthesist, even the neonatal team is there, ready for the baby. It's a true all-hands-on-deck response.
And that brings us to practice. That whole team, they don't just meet for the first time during a crisis. They train for this, over and over again. They run simulations, these incredibly realistic practice drills, so that when the real thing happens, it's not about panic. It's about muscle memory. Everyone knows their role.
So when we pull back and look at this whole thing, what's the big takeaway here? Why does understanding this complex process really matter?
Look, there's no way around it. The idea of a maternal collapse is absolutely terrifying. But the real story here isn't the chaos of the event. It's the order of the response. It's a testament to a system built on preparation. It proves that with incredible teamwork and constant practice, you can create a calm, coordinated plan in the middle of a crisis and give both mother and baby the best possible chance at survival. And for those of you who want to dive deeper into the science behind all this, our explainer today was based on the Green Top Guideline from the Royal College of Obstetricians and Gynecologists, which was published in the British Journal of Obstetricians and Gynecology.